Hello, welcome to the Duty to Warn vidcast. I'm John Gartner, your host, and today we have Dr. David Reiss with us. Dr. David Reiss has been a practicing psychiatrist for over 30 years. He's evaluated over 12,000 patients. He's a recognized expert in a number of areas, including personality disorders, which we'll be discussing today. And he recently co-authored in the Huffington Post an article, The Eternal Emperor in His Own Mind, which is a discussion of Donald Trump's narcissistic personality disorder. I have some specific questions about your article, Dr. Reiss, but maybe for the audience you could orient them and let them know basically what you've said in that article.
Sure. What we did in that article was to look at some of the both general and specific issues related to personality dysfunction without going into specific diagnoses or knowing what Trump does or doesn't do behind closed doors, based on his public behaviors, based on his actions, the type of pathology that's exhibited. And we went very specifically into distortions in appreciating time, appreciating the passage of time, and basically what's termed impressionistic thinking, basing reality on emotions at the moment rather than facts and logic.
So actually, let me just talk more specifically about some of the things that you say. So you say that he distorts external reality. Could you say more about that? I think that's extremely important.
Sure. Of course, what's going on in his head, I don't know. I can't do a Vulcan mind probe and find out. But certainly from everything he says, from everything he does that we see, his actions, his statements are just inconsistent with the factual reality. And somewhere, if there isn't intentional lying or intentional, channeling Andy Kaufman or something, this is a distortion of reality that's going on somewhere within his psyche.
You use the term quasi-delusional state.
Right. Yeah, technically and clinically we use delusion to mean a fixed false belief, generally related to a psychosis, which is a thought disorder. When we're talking about distortions coming out of personality disorders or anxiety, they're usually not fixed, they're more fluid, they may change from time to time, and although they may be equally as illogical as some delusions, they have a different quality to them. So in terms of, is this in contact with reality? Well, it's illogical and irrational, but it's clinically a somewhat different animal than a fixed formal delusion.
Yeah. Well, what would be some of the differences that we would look for?
The stability over time. Someone who's either in an acute psychotic episode or a chronic psychosis, during that episode, their beliefs are not going to change. Whether it's just a relatively rational distortion, meaning that it could make sense but it just isn't true, or whether it's bizarre, it's going to basically stay stuck until the illness is treated, if it can be treated. On the other hand, the distortions that come out of personality traits, narcissistic traits, are much more fluid and will change basically from moment to moment, minute to minute, day to day, depending on what serves the person's emotional needs at that moment. And at times they may be more reality-based, at times they may be totally non-reality-based or irrational, but there won't be the consistency that's often present in psychosis, even if that consistency is irrational.
And so Eric Fromm, who introduced the concept of malignant narcissism, said the malignant narcissist lives on the boundary of psychosis.
Yes, yeah, I think that's a very good way of putting it. It's really a spectrum, and yes, they're right on the boundary there.
Okay. You also mentioned they live in the moment with little regard for linear time, cause and effect, or behavioral consequences.
Yes. Yeah, that's an issue that, to be very honest, it's something my patients over the years have taught me, because this is an area that I've done a lot of work in, evaluated and treated a lot of people. And I've come to understand that they really don't appreciate emotionally the passage of time. This goes back to like Vonnegut described in Slaughterhouse-Five, that trauma leads to being unstuck in time. Generally, in order to function in this world, and leaving particle physics or different esoteric theories aside, we have to see time as moving from past to present to future. I paid my rent last month. I have to pay it this month. I'll have to pay it again next month. On the other hand, with this type of pathology, rather than seeing time as moving linearly, it's more like a big bubble of events that just keep accumulating. But all the events may or may not be in the immediate present, or may not be related chronologically in a linear way. In other words, what happened 10 years ago may feel very much related to something that happened 3 days ago, and that's where the person lives, that they are actually experiencing time in that disorganized way.
And you said when the narcissist is confronted with evidence of reality, that oftentimes the reaction is paranoia.
Right. The defenses are there basically to prevent the person's self-esteem from feeling attacked. And when the self-esteem is attacked, there are 3 ways to go. One way is to say, oh, gee, something's wrong. Let me do something more effective, which I'm in old school, so I still use the term neurotic, and that doesn't apply to personality disorders.
Right.
The other way is to just sort of collapse into depression and give up. And the third, in general, way is to say, someone's really screwing with me, and then come up with some rationalization that may have a grain of truth or no truth or whatever. That's basically on the paranoid spectrum.
So you have one thing in common with Donald Trump. You like to tweet.
At least recently. Yeah.
Well, you've got 7,000 followers. I'm impressed with that.
Yeah, that's grown over the last 2 months from 1,500. And to be honest, all my social media was nonpartisan until Trump. I would have dealt mostly with mental health issues, and I'd let the chips fall where they may in terms of political issues regarding mental health. But I wasn't politically active in social media, but I felt the need to be now, and my following's grown.
Well, actually, that raises an interesting point. Some people have argued that those mental health professionals who are speaking out against Trump are just partisan. Would you like to speak to that? Especially if you look at my feed, I really don't get into the partisan issues. I mean, the things that Trump says, well, if he has any policy, but there are policies he's talked about that I may agree with, that I may disagree with. That's where I see this as very different from Goldwater. I'm not analyzing Trump's policies from a psychological point of view. I'm stating, what I see is a man who appears unstable, at least in public, who isn't thinking clearly, who isn't speaking honestly. And I don't care what his position is, and I don't care whether I disagree with it or agree with it. It's not safe to have someone who's that unstable in office. Actually, a number of your tweets are about his, I guess I would say, mental status.
Yes.
And so I wanted to speak to some of those. One of them you talk about his use of projection, denial, projective identification. Maybe you could say more about that. You have more than 140 characters here, so.
Right. Yeah. Some of those tweets I've done spontaneously. A lot are in responses to people asking questions, where I'm basically trying to provide information. Again, not having diagnosed them, but just on a common sense basis. If you see someone do something or say something, and then deny it and accuse someone else of doing the same thing or saying the same thing, that's consistent with the defense of projection. That's basically all I'm saying with that. Now, projective identification is a bit more complicated. To try to sum it up, which is difficult to do,
I know,
even in a clinical setting, the uncomfortable act or emotion is projected onto someone else. But rather than leaving it there, like, okay, this person's after me, this person did that, it's their fault, the person who's projecting then sort of identifies it and sort of half recognizes, but I do that too, which takes it to sort of a meta level of anger and frustration and fear, and makes everything even more complicated, often leading to even more projection and very strange distortions.
Well, and I think your point about projection is really a good one, because one of the things I've always said about Donald Trump is if you want to know what he's actually doing, see what he's accusing others of doing.
It's certainly better than listening to him concretely.
Right. But you can almost translate it. I think, in fact, when your comment about projection was in relationship to some tweet where he said, the Democrats don't want health care. Or, in other words, or during the campaign, we should never have someone under FBI investigation, and now he's under FBI investigation. But sort of, if you want to know what he's doing, see what he's accusing others of. Well, there's also a series of your tweets that I wanted to address that relate more formally to mental status. You talk about his immature grammar, vocabulary, and syntax that suggests a disorder or a deterioration of language skills. You say there's no logical way to conclude anything. Oh, sorry, I want to get to that one later. But you said Trump forgot Paul Ryan's name, and that suggested some kind of cognitive distortion. You said he's botching the English language, and that shows a distorted thinking process. So these are some kind of formal evaluations or assessments of his cognitive functioning. And this is becoming much more of an issue now. People are really wondering, does he have Alzheimer's? What's going on with his butchering of the English language? Is he getting worse? Could you address those issues?
Sure. I've really taken the stance that without neuropsych testing, without a full evaluation, you can't really make a diagnosis, but you certainly can make observations. And the observations are that he makes a lot of mistakes with grammar. He makes mistakes with spelling. Now, this can be as benign as having some dyslexia. I have dyslexia. I make the same mistakes. It's not disqualifying. In fact, what I've said is if he does have dyslexia, it's a shame he's not admitting it and, basically promoting treatment for that. And,
he could be the poster child.
He could be the poster child, but that's basically benign because that wouldn't interfere with governing. On the other hand, when you see things that just don't make sense, as opposed to just what could be a simple error.
Covfefe.
Covfefe. You have to question what is going on. And what I tend to do is put in my tweets the possibilities. I don't know what's going on. I don't jump to saying he has Alzheimer or this or that. It could even be side effects from a antihypertensive that can cause some word finding difficulties. So I'm observing impairment or basically a significant change in his sharpness from videos that are available from years ago. Now, of course, some of those were edited, some of those were scripted. He was more prepared. He certainly wasn't under as much stress. So I don't go to, it's clear he has Alzheimer's, or it's clear no, it's not clear to me at all what he has. But it's clear that he's not functioning and communicating as effectively as he did 15 years ago. Not that there weren't some issues there, but they were much more subtle.
So you're really seeing signs, though we don't know the etiology, you're really seeing some signs of cognitive deterioration that are notable.
Yes. I mean, you listen to him at times and it just doesn't stick together. The associations are all over the place. The constant going back to talking about himself, to talking about the Electoral College. Now maybe some of that's intentional, but it really seems more coming out of some type of emotional or cognitive disruption. Again, I don't know what's causing that. It could be any number of causes, or most likely a combination, but it's certainly prominent and disruptive to functioning as the president.
You also talked in one of your tweets about this phenomena of gaslighting, that the president is obviously lying, and yet there's this sort of attitude, not to single anyone out, but I'm talking to you Republicans, this that sort of acting as if this is normal.
Right. There's always been spin, even before we called it spin. There's always been manipulation. Politics has always been dirty. Nixon took it to a somewhat higher level, although even that really wasn't that much out of the ordinary other than the cover-up of it. But what we have here is really spin and distortion on steroids. And it's called gaslighting, and that goes back to literature. But basically, it's when someone, and often people with narcissistic traits do this, try to engage other people by putting them in the position that I'm going to say something that's so bizarre that's so inconsistent with what you are thinking, feeling, seeing, that you only have one or two of two conclusions to make. I'm effing crazy, or you're effing crazy. And a secure person is going to stand back, look at it, may feel anxious, may get confused, but come to the conclusion, I'm okay, this person's got something wrong. Whereas people with vulnerabilities, people who are more dependent, and a whole host of issues, are going to question themselves and may get to the point of really giving up on their own thought processes, their own rationality, and just following blindly. Basically, gaslighting is nothing more than cult mentality. And it's been around forever, it will be around forever, but it's being introduced into the political process at a level that's never been at this extent that I know of.
This reminds me of some of these social science experiments where they have Confederates that say the line that's longer is actually shorter. And, the undergraduates will say, oh, okay, well, I guess everyone else thinks that one's longer. I guess it's longer.
Right. And that can go from, again, using the term neurotic to there are 30 people in the room. I'm the only one who thinks this way. Maybe I'm wrong. And really, and that's a reasonable thing to consider. If I'm in a group of a lot of people and everyone else is thinking differently, maybe I am wrong. A reasonable person will reconsider. But if you reconsider and you see that you are logical, reality is not defined by consensus. It's defined by facts. And if you can clearly state the facts to support your point of view, then you have to basically be assertive enough to say, I don't care if there are 2 people, 20 people, or 200 who disagree with me. This is my point of view. Many people don't have the strength to do that and will go to, this person's got power, this person's got money, this person's on TV. They must be right. There must be something wrong with my thinking, even though I can't recognize what it is. And particularly people who have vulnerabilities, who've been abused in the past or been traumatized, it's easy for them to give up on their own logic.
We're not all Jim Comey.
Right.
Well, actually, Robert J. Lifton, who spoke at our conference at Yale, used a term that he's coined that I think is very important. He calls it malignant normality. It's kind of the societal side of malignant narcissism, which is the thing I've been, trumpeting. But if you have a malignantly narcissistic leader, he begins to change reality for society. And then you have essentially abnormality becoming normal.
True. Yeah, actually, that's something that I've been talking about. Unfortunately, I haven't published it, but I've used the term, which is really very similar, social irrationality, where exactly that the group think takes a quality that just leaves reality behind, and then it takes a life of its own.
Yeah. And of course, famously, it is sadistic dictators who create this kind of malignant normality. Hitler, but others, Stalin, Pol Pot, whatever, that they shift their entire societies in line with their malignantly narcissistic visions.
We could go back to the writings of Plato and see him talking about it. He just wasn't tweeting about it.
Very good. Well, thank you, Dr. Reiss. This has been a really helpful interview, and appreciate your writing, and keep tweeting.
Thank you. My pleasure.
All right. Thanks for talking to us.
Anytime. Thank you.
Bye-bye.